These centers are the worst possible way to redistribute resources to families, and this money should be directly given to families in need. Finally, the House proposal includes a near total elimination of funding for ODH's lead hazard control and prevention efforts. It should go without saying that exposure to lead in any amount, especially for pregnant individuals and children, is dangerous and causes harm. We urge the committee to reinstate this funding at the full level so that the individuals that rely on these services can keep themselves and their families safe. Thank you, and I'm happy to answer any questions you have today.
Very welcome. Questions? Seeing none, thank you. Okay, next we have Amelia Elise Green, Trans Unity Coalition. Welcome, you may begin.
Greetings, Chairman Huffman, Vice Chair Johnson, Ranking Member Liston, members of the Senate Health Committee. Thank you for the opportunity to provide testimony in front of you today. My name is Amelia Elise Green. I'm a 27-year-old transgender woman and an Ohioan. I'm married. My wife and I are trying to buy our first home. We're both active members of our communities and students. My wife is currently finishing a degree in audio engineering, and I'm studying to go to med school. Transgender people are not an ideology. We are real people. We exist, and we deserve the same rights as anyone else. The fact that I feel compelled to stand here and justify my existence and the existence of millions of others of people like me in front of you all today is frankly absurd. And yet, I find myself doing exactly that due to the multiple anti-trans provisions in House Bill 96. Section 9.05 declares it as a policy of Ohio to recognize only two sexes defined solely by gamete production. This is biologically inaccurate and legally problematic. First, intersex individuals exist. These are people born with variations in chromosomes, gonads, or anatomy that don't fit traditional definitions of male or female. Some may produce both gametes or none at all. This law excludes them entirely. Second, all embryos start with the same basic reproductive structures. Defining sex as fixed at conception contradicts our understanding of biology. This language mirrors recent federal executive orders, not peer-reviewed science, and it is deplorable, plain and simple. This provision only exists to deny the existence of trans and intersex individuals and to open us up to further discrimination. Section 333.13 would block Medicaid funding for any mental health services that promote or affirm social gender transition. This contradicts the standards of care endorsed by every major medical association, including the American Academy of Pediatrics and the American Psychiatric Association. Social transition is not medical intervention. It may include a name change, different pronouns, or clothing choices. Support for this, especially in youth, is proven to improve mental health outcomes and reduce suicide risk. I can speak to this personally. As a teenager and young adult, I struggled intensely with both depression and suicidal ideation. These feelings did not go away until I accepted who I truly am. The same is true for my wife, who attempted to take her own life at one point prior to her transition. In the case of medical intervention, gender-affirming care is no different from any other form of health care. It is also not exclusively utilized by the transgender community. A cisgender man receiving hair implants or being prescribed medication for erectile dysfunction are examples of gender-affirming care. A cisgender woman taking estrogen to combat the effects of menopause is also. Denying people access to gender-affirming care solely because they are trans is blatantly discriminatory. If you are okay with a cis person receiving this care, but you are not okay with me doing the same, you are not just repeating bigoted rhetoric, you are actively being a bigot yourself. Additionally, the discriminatory nature of this provision wasn't enough. It could have broad unintended effects. If one program or provider within a major medical system is deemed affirming, the whole institution will lose Medicaid reimbursement, impacting potentially thousands of patients beyond just the transgender community. Laws targeting transgender Americans negatively impact all Americans. When it comes to the appropriation of funds to youth shelters, the bill includes the following statement: no funds shall be distributed to youth shelters that promote or affirm social gender transition. Unhoused children are already some of the most vulnerable members of our society, even before considering the fact that they may identify as trans. A child has every right to question their identity and explore who they are as a person. They should not be forced to hide their identity and live in the closet in order to have access to the most basic forms of support. However, that is what this provision would have them do in order to not be forced out onto the street. Section 9.561 contains the following line: no government entity shall place menstrual products in the men's bathroom of a public building. This bill would deny transgender men the same basic medical hygiene that any cis woman is given. If they wanted to have access to hygiene products, they would need to venture into a woman's restroom in order to find them. Not only would this undoubtedly be an uncomfortable experience for them, it has the potential to be very jarring for any women currently using the restroom. Trans men are men, plain and simple. To any members of the community with young daughters, how would you feel if a man with a full beard entered the restroom behind your daughter? That is what this bill would accomplish. Think about the absurdity of that. Anti-trans provisions are always brought up as ways to preserve women's spaces. This quite clearly does the opposite. It forces men, actual men, into them. These provisions are not grounded in medical science and pose real harm to vulnerable people. Transgender and intersex people have existed for as long as humanity has. We are not an ideological movement. We are people, the same as you. I urge the community to consult with clinical experts, to listen to their constituents, and to revise or reject these discriminatory sections. If this does not happen, you will be directly responsible for the deaths of Ohioans, people that you have promised to protect. Thank you for your time. I welcome any questions.
You're very welcome. Questions? Seeing none, thank you for coming in today. Okay, now next we have Geraldine Donna Evangeline Hartman, Trans Unity Coalition. And I would once again ask us to respect the 3-minute limit there. We do have the testimony on our iPads, and we will go through it. So if you can restrict it to 3 minutes, I'd appreciate it.
I'll trim it down a bit, sir. Thank you.
You're welcome.
Thank you, Chairman Huffman, Vice Chair Johnson, Ranking Member Liston, and members of the Senate Health Committee for the opportunity to give my testimony today. My name is Geraldine Donna Evangeline Hartman. I'm a 45-year-old transgender woman from Dayton, Ohio, born and raised. I have worked and paid taxes most of my life since I was 16, and I only recently qualified in January for disability. I presently am going through a divorce after 25 years together with my wife, who had billed herself as a trans ally for most of the 19 years that we were married. We have 2 wonderful children together, ages 14 and 17. And you could be forgiven for thinking that my recent pursuit in coming to terms with my gender identity has had greater impact on the trajectory of my relationship than it actually has. You see, that's not true. My wife has actually known about my gender identity since 2 months into us dating years ago. When we first met, she was also dealing with gender identity, gender dysphoria of her own. So I'm here as a transgender woman to give testimony as somebody who really exists, who's not a paid actor, and who is a human being as your constituent that has flaws. And we're real people. We exist, and pretending that we don't just because of some words on a document it's a disservice not just to us, but to also intersex individuals who do exist. There's actually a 1.7% incidence of intersex individuals for every 100 people born. So every law that affects transgender people also affects them. And they don't have a choice, as if this is a choice. They're just born that way, and you're directly hurting them. There are provisions that have been added to this bill that are directly harmful against transgender individuals and intersex individuals as well. Within the article exploring biological contributions to human health, does sex matter, from the National Institute of Health, all human individuals, whether they have an XX or an XY or atypical chromosome combination, begin development from the same starting point. During early development, gonad and fetus remain undifferentiated, and that's for 6 to 7 weeks. So defining gender based on the gender you have at conception would mean that all of us are female, because for the first 6 to 7 weeks, that's what we are. We don't start developing Y chromosome factors until 6 to 7 weeks later. So just the bad science in this alone is enough to give pause and say, maybe this shouldn't be part of our state laws. But also, we're real people, and doing this has got no other purpose other than to try to hurt an already marginalized part of the community. So thank you for your time.
Well, thank you very much. Is there any questions for the witness? Seeing none, thank you very much today.
Thank you.
Next up, Bree Taylor from the Trans Unity Coalition.
Chairman Huffman, Vice Chairman Johnson, Ranking Member Liston, and all the other members of the Senatorial Health Committee. Thank you for being here. Thank you for listening to the public today. My name is Bree Taylor. I am blessed by she, her pronouns, and I founded and serve as the Executive Director to the trans advocacy nonprofit Trans Unity Coalition. Over the past month, our team has been providing awareness to several of the anti-trans provisions contained in House Bill 96, which there are a number of them, unfortunately. Because of the time constraints, I will go through this a little bit quicker to respect time, as you're all here with very important messages as well. Line items 133338 through 133,346, defining Section 291, subsection 20, refers to cutting all Department of Health general revenue funds set for youth homelessness shelters that cover both youth and pregnant women, should a shelter promote or affirm transition, through wording that is broad enough to include not just the transition of those who are using these shelters, but including the staff as well. Very broad wording, very confusing. As a former foster child, access to shelters for myself was the last line of defense from living on the streets. And as someone who experienced living on the streets as well, I want to make this very clear. Shelters save lives. They protect childhoods. They're important. They are vital to any society that truly cares about its people. But they must be equitable, accessible, and welcoming of all people, including the transgender and non-binary communities. Much like any safe space, a firehouse, a house of worship, a shelter must be maintained as a non-political environment, freely open to all. Roughly 40% of homeless youth are LGBTQ+ in America, showing a clear disproportionality from the base of 7.9% LGBT+ of all Americans. That is practically flipping a coin. And it should not come as a surprise that even in this day and age of 2025, many underage runaways and those kicked out of their families came into that position simply because they are queer, simply because they were rejected, and in this case, simply because they are trans. Yesterday, I shared in the Senate Education Committee that 40% of queer youth make an attempt on their own lives. In the time it took to share this testimony right now, that was 4 new attempts in America. In the time since I made the testimony yesterday, 1,444 suicide attempts. These are not phantom numbers. These are cold statistics that speak to the need to do better to protect queer and trans youth. And often, these are kids that were simply rejected for who they are. These are children who absolutely deserve love, inclusion, and safety, not more rejection from the state. Please, please, please reconsider this provision. On behalf of myself and the many who did not feel safe to send testimony or be here today, we implore you, please consider removing this line item and all other harmful provisions that will hurt Ohio's transgender community. Thank you, and I'm open for questions.
Thank you very much. Is there any questions for the witness? Seeing none, thank you very much.
Thank you.
Next up, Leah Passatini.
Close, you almost got it.
You know.
Chairman Huffman, Vice Chair Johnson, Ranking Member Liston, and the members of the Senate Health Committee, thank you for the time and the opportunity to give this testimony. My name is Leah. I'm a lifelong resident of Ohio. I'm also a transgender woman. I come today to speak in opposition to harmful provisions contained within HB 96. I love this state. My entire life is here. If these provisions are allowed into the budget bill, it'll make life a lot harder for people like me. They feel like an attempt to push people in my community out of the state. The first provision I want to bring attention to is on page 25 and has absolutely nothing to do with the budget. This section contains a provision that is essentially a mirror copy of a federal executive order defining sex. This executive order has been widely criticized by many, including experts. Anyone with an understanding of biology knows that the wording and definitions contained within it are essentially nonsense. They don't provide an accurate framework, and for that reason, it fails at a fundamental level to be useful or even workable. This executive order also ignores a variety of diverse individuals, such as intersex people. Intersex people do not fit neatly into a category of male or female. They can have anatomical, developmental, or chromosomal differences that vary from what we traditionally think of as male or female. The reality of sex and biology is more complicated than a simple binary. The adaptation of this executive order would essentially be a virtue signal, one that says that my day-to-day reality is wrong and that people like me do not belong in Ohio. The next provision I would like to bring attention to is contained on page 4,670. This is a provision that allocates money to be spent on projects that provide shelter to unhoused youth. This by itself is a wonderful thing. I think we can all agree that youth in our state should be protected and should not be forced onto the streets to die. That's why I find it so concerning that immediately after stating the allocation of funds, there is another statement saying that these funds will be withheld entirely from shelters that promote or affirm social gender transition. This does not refer to gender-affirming medical care. This refers to using a person's correct pronouns or using their name. This means that shelters, if this passes, will have a choice. They can reject trans youth from their shelters, which would force underprivileged children onto the streets to die. The other option is to accept trans youth, and for that reason alone, lose funding and lose vital services for many youth, not just youth in my community. I want to stress how this section goes out of its way to make a clause specifically targeting a minority group. Imagine if instead of targeting trans youth, it was written to target racial minorities or religious minorities. I don't think anyone on this committee would argue that that's an admissible thing in a budget bill. So I pose the question, why is it acceptable to target my community? In closing, I want to say this. Ohio has signs all over that says Ohio welcomes you. If this budget bill goes through as is, that would make these signs a lie for people like me. It would send a signal that people in my community who live here, have family here, work here, and love here are not welcome. I urge you all to reconsider these provisions. This bill should be one that betters Ohio for all its residents. I urge you to revise or amend these sections to make that a reality. Thank you for your time. I'm open to questions.
Is there any questions for the witness? Seeing none, thank you very much. I'm going to go backwards to Tishiana Kawaki, CEO project, just to make sure she's not here, that we skipped over her because she didn't answer before. I do not see her. Next up, Matt Deaton, Association of Ohio Pediatrologists. Hey, first, what is a pediatrologist? And how do you pronounce it?
Pedologist.
Okay.
It is the study of the formation of soils and the classification of soils.
All right, thank you very much.
All right, Chairman Huffman, Vice Chair Johnson,